Increased demand for professionals in healthcare during the COVID-19 pandemic, the role of students is expected to make a major contribution. To talk more about this, we're joined by Professor Ian Couper from the University of Stellenbosch's Department of Global Health. Prof, good evening to you. Thank you so much for your time. I think the shortage of healthcare professionals is a reality we cannot escape in our country as we approach the peak in COVID-19 cases. Your research has looked at the valuable role medical students can play in supporting healthcare delivery. What did you find?
Good evening, Clement, and good evening to the viewers. Yes, you're absolutely right. We've got an absolute shortage of healthcare workers, and that is worse in rural areas, which is the particular focus of the Ukwanda Centre for Rural Health. But we looked at students that we put out, and this is medical students, occupational therapy, dietetics, physiotherapy. We send them to approximately 70 different sites, and we selected a few, and we asked staff there, those who were supervising the students, other clinicians, and managers, what was the contribution of the student? And universally, they were very positive about the role the students can play in terms of improving patient care, in terms of helping the service, in terms of improving their atmosphere, in terms of reaching out into the community, helping community members, and even in terms of motivating the staff in terms of their work.
What are the other factors that contributed to their effectiveness?
One of the key things we realize is that we've got to have the right students. So from our side as the university, we've got to make sure they're properly prepared and properly trained. It also works better with senior students. There is a role for junior students in terms of other activities, perhaps. And here, sorry, just to be clear, we're talking about facilities outside of the main teaching hospitals, regional hospitals, district hospitals, community health centers, and clinics. And at those levels, if you have senior students, final years or near final years, who have already a lot of training background and are now just implementing it practically what they've learned, they're the ones who can really make a difference. And one of the aspects of that is that they have time. Health workers are rushed off their feet. Students have time to spend listening to patients, to understand exactly what's going on, and then can consult their supervisor in terms of how they best meet the needs of the patient.
And this speaks a lot then, Prof, I suppose, to the work universities where they come from have done.
Yes, I mean, we have to make sure that obviously we are preparing our students for that. And we do find that some students take to it better, and we've got to be better in terms of preparing them and making sure. But it's critical as well, not just for the students and the healthcare now, but also in terms of making sure that people feel comfortable to work at a range of different facilities, because when they graduate, when they are professionals, they're going to need to work across the country. We can't have them only being able to work at an academic hospital.
Yeah, we're facing a situation now, Prof, where many students are still not back on campus. The Higher Education Department is in the process of phasing in final year students who need to be on campus, especially those whose training is practical, like medical students. What is it that the health facilities can do to assist these students and in that process assist themselves as well?
So it's important to understand that for final years and a number of the senior years, in fact, they don't spend much time in the classroom. Their main focus is on working in health facilities, and the more health facilities we can get them into, the better. So really, we're saying that they are a resource, that the health department needs to see them as a resource and welcome them back. Because what we found is that the education department can say, yes, the students can go back. But then we've got to talk to the health department, and the health department has to say, yes, they can come into our facilities, because we don't have our own facilities. They're all public health facilities. That's where we train. And if from a health department side, they can be saying, please, we want your students, bring your students. That'll help us. We're actually struggling to find enough sites in which we can place our students so that they can meet their outcomes of training by the end of the year, those who are in their final year.
And what we have also observed since the pandemic hit our shores is that some aspects of healthcare are receiving less attention because resources are mobilized to address the pandemic. And I imagine if these students are allowed to train in those facilities, that can assist they can assist with that. There can be a great contribution in making sure that we are not also losing sight of also some of the critical aspects of healthcare that seem to have been abandoned over the last couple of months.
Absolutely. We don't want to expose students to higher risk areas, and as from the health department side, they also don't want to expose our students and take the liability or risk of doing that. So there are low risk areas that the students can work in, leaving the qualified health professionals to perhaps focus more attention on the high risk areas. So they can work in areas such as under 5 child health, immunization, growth monitoring, and so on. They can work in monitoring and managing patients with chronic illnesses, work with patients with disabilities who need rehabilitation, work with TB and HIV. There are many areas in which they can make a difference and are critical areas that we are not giving enough attention to at the moment.
Thank you so much for your time. That was Professor Ian Couper from the University of Stellenbosch.